Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. On one hand, long queues at public hospitals, and on the other, astronomical bills at private ones. So for many Malaysians, there's really no good option. That's the gap that Rakan KKM claims to fill by offering fee-based expedited care for non-emergency procedures inside public hospitals. Now, is this a pragmatic third lane between the extremes of unaffordable private care and overstretched public hospitals? Or does it risk deepening inequality by allowing those who can pay to skip the queue? Well, joining me now on the show today, help me think this through, is Azrul Mohd Khalib, who's the CEO of Galen Centre for Health and Social Policy. Azrul, thank you so much for being on the show. So we've only been reading bits and pieces about the articulated vision of what Rakan KKM is meant to be. But for someone who is watching the industry, what have you heard? What do you understand about what Rakan KKM is meant to look like in practice?
Well, Melissa, Rakan KKM, as far as we understand it, is actually the Ministry of Health, and specifically the Minister of Health's response to the emphasis to the Ministry of Health that they can't go back to the Ministry of Finance each year asking for more money. It does become a little bit like Oliver Twist. Please, sir, can I have some more? And it is so much that it is only so much that the government is able to provide for health each year. And even though we see there's a few billion that increases, there is unfortunately a limit as to how much will be able to be afforded to healthcare each year, considering the fact that the development budget also needs to compete with and accommodate other concerns such as social welfare, socio-economic issues, education, and so forth. So Rakan KKM is really intended to generate revenue, supplementary revenue, to complement the existing budget allocation that is provided under the federal budget. And this is something that is very important for people to understand. It's first and foremost intended to generate that revenue, and intends to do so by providing a pathway for expedited healthcare services that are, not so much like the private healthcare services that we see, but definitely better than we see right now in public service. And it will focus on elective procedures, I think you mentioned, and diagnostics. So emergency services won't be a factor or be involved in this. And it will provide a standard of care that's going to be very familiar to those who are accessing private hospitals right now, but it's at much reduced rates. So on paper, the revenue generated from the fees charged onto patients who are accessing Rakan KKM is actually intended to feed back and supplement and provide support for the public healthcare services, and also sort of provide a little bit of more compensation for some of the medical professionals, specialists, doctors, and even nurses and medical assistants at that point in which they are involved. So Rakan KKM is now Rakan KKM Sdn Bhd. So it's actually a company that is owned wholly by the Ministry of Finance Incorporated. So a lot of people will be very familiar with this kind of model, which is similar to what we see with the Institute Jantung Negara, National Heart Institute, which is a lot of people thought was very much 100% under the government, but it actually was a Sdn Bhd in itself. And they are able to generate their own revenue and also develop and expand.
All right. Okay. So I mean, even though I think there's been quite a lot of debate around whether or not Rakan KKM the model is perfect or imperfect, at least this is an attempt to rethink how we fund and deliver healthcare in Malaysia. Can I ask you then, Azrul, what would be the obstacles in achieving this vision?
Well, even from what I'm saying to you right now, Melissa, there are a lot of obstacles. Rakan KKM is not ideal. It is basically, I would argue, a band-aid solution to a much more long-term institutional issue, which is insufficient funding and investment in health, for which today we are having to address the consequences of, which is a sicker population, but also services that are struggling to keep up with the demand of more and more people needing healthcare for diabetes, cardiovascular disease, respiratory tract infections. And even when we saw during COVID, we saw a fair amount of that having to struggle and provide the kind of care. But we were able to do that only because a lot of issues were able to be, bypassed or overlooked for the purposes of the national interest. Having said that, for Rakan KKM, one of the key obstacles that it needs to address is really about manpower. And this is something that we've spoken about for quite a long time now, in which we are saying that, for example, we have not enough specialists from all fields, and we are currently, if we look at the gap between what we should have and what we have, the gap is around 11,000 specialists, both in public and private sector. So the thinking here is that maybe Rakan KKM can make use of surplus or excess capacity just isn't really there, because even nurses, Melissa, we're short on nurses too. And these are the gaps in nurses is in 20 and 30,000 when we look at both in terms of public and private. So there is a situation here where the obvious question that is going to be asked is, how is the government going to be able to provide the manpower that's going to be necessary to set up this third stream, if you want to call it that, third pathway, to provide these services within the government setting, for which it will be a sort of a private wing. So there's 4 hospitals that have been identified for involvement in Rakan KKM: the Hospital Serdang, Hospital Putrajaya, Cyberjaya, and the Institute Cancer Negara, the National Cancer Institute. So these 4 hospitals have been designated, and at the same time, these are also hospitals that are seeing huge number of patients accessing services, especially in Serdang and Putrajaya. So where are we going to get the manpower?
Right.
How are we going to isolate the needs for this?
Right. Azrul, talking about the specialist shortfall in the public sector, it's well documented, as you said, the brain drain among public healthcare workers into private. So is there an argument to be made that Rakan KKM will actually allow for or provide a much needed incentive structure, a way for the specialists and the nursing staff, for instance, to earn more without actually leaving the system entirely?
Well, this is not a new concept, Melissa. We've seen from the full paying patient scheme, the FPP, which has been around for, I think, more than 15 years. And it has been something that has been implemented, and we're able to learn from the lessons of the FPP program to see what worked and what didn't. In that particular case, they had 10 hospitals involved, and they were able to collectively, in 2017, the last time it was documented in terms of how much revenue they were able to bring in, it was around 20 million. So they were able to bring 20 million out of 10 hospitals involved, for which is average of 2 million per hospital. Now, that sounds like a lot until you realize that it's not. Our actual amount of need is actually in the billions, not single digit millions or double digit millions. So the issue here is that, have we learned enough from the FPP program? And we realized that when it started off with 10 hospitals, it decreased in number because more and more specialists were leaving anyway the service, because it wasn't enough to keep them in their post, because the private sector is a competition. Other countries are also competition. Singapore, UK, Australia, New Zealand, they're all looking at our specialists, our healthcare professionals, because they're good quality, expert individuals. Some of them are world-class. So of course they want to bring them in. So unfortunately, the FPP program today is actually very much diminished, and it really is only for specific services. So if you are a pregnant, expecting mother, you're wanting ONG services, yes, you can go FPP, because the one thing that seems to be consistent for many of the hospitals participating in FPP is that they have an obstetric and gynecology service for which a lot of people are accessing. And that's very important to realize. When we talk about Rakan KKM, it doesn't mean that every single service that involves elective surgeries, procedures is going to be available. It's not. It's going to be very specific, maybe 1 or 2 services and specific procedures. Now, that comes back to the other issue concerning the obstacles, and that is, these are the same services that are going to be dependent on the same equipment, same expertise, same labs. When is this going to happen? Like when is the Rakan KKM needs going to be addressed if they are also competing with the public patients that are happening at the same time? Now, I've seen a lot of responses that seem to be cavalier in suggesting that the Rakan KKM specialists will work at night after office hours. So they will do all their public patients first. After office hours, then they go to Rakan KKM and do the diagnostic tests, they do the consults and so forth, which is very bad when you consider that Rakan KKM is supposed to, be this premium service where you're supposed to be able to get the attention of the consultants that you want, when you want it, and get it quicker. But if these guys are supposed to do it after they finish all the public service, then when are they going to do it? Who's going to do an MRI or CT scan in the middle of the night, for example? And this is where the same equipment is going to be utilized. We need to see where is it that we can have the benefits of that. And most importantly, what kind of revenue charges are going to be expected from Rakan KKM. And this comes to the third issue, Melissa, which is there enough money that's going to be generated from Rakan KKM that it's going to be able to go back into the system to build investments, to build new hospitals, pay our private wing better in terms of medical professionals, the specialists, the nurses, modernize equipment, digital health, modern infrastructure? Is there going to be enough? Because the last time I checked, the most profitable private hospital in Malaysia was KPJ Healthcare. And they made around 957 million in the first quarter of this year in terms of revenue, out of which 57 million was profit, if I'm not mistaken. So you made a lot of money, but what feeds back into the profit is this much. So in order for Rakan KKM to be able to demonstrate the kind of outcomes or outputs that we're expecting, they have to make a lot of money. They have to make it very soon. And most importantly, they have to charge probably higher, much, much higher than what we're talking about right now, to maybe the point similar to a private hospital. So, this thinking that private paying patients who are going to be willing to be charged and pay higher rates is true, but only to a certain extent, right? So how do you attract patients? It's going to be a competition between private hospitals and Rakan KKM, and you have to be able to provide the most important pull factor, which is time. Will it provide quicker service? Will it provide better service? But also, will it mean that you have timely and effective access to treatment that works for you?
Azrul, thank you so much for flagging some of those issues for us. We appreciate your time. Azrul Mohd Khalib, CEO of the Galen Centre for Health and Social Policy. We're going to take a quick break here and consider this. We'll be back with more. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about Rakan KKM, which is a new initiative said to be public hospitals offering fee-based services to skip the queue for some elective procedures, but at below private care prices. Joining me now is Dr Mark Cheong, a public health and palliative care researcher. He's the deputy head of the School of Pharmacy in charge of education at Monash University, Malaysia. Mark, thank you so much for being on the show with me today. Rakan KKM really has sparked some strong opinions, and I'm curious to know what your take is. What do you think Malaysia is really grappling with through this reform of Rakan KKM?
Thanks very much, Melissa, and again, thanks very much for having me on this conversation. I think it's a topic that all of us are really interested in. Many of us Malaysians, I dare say all of us Malaysians, are very much invested in the health of our national health service, and millions of Malaysians use it every day. So it's no surprise when there is talk of a scheme that might potentially privatize or potentially charge more for services, provides an avenue for people with more money to cut the queue, so to say. So it's not unsurprising to see people all up in arms about it. And I think one of the reasons why it's also generated perhaps a lot of controversy and a lot of buzz is that we know so little officially about it. A lot of it has been spoken about in social media. There are some media platforms that have published reports from sources who must remain anonymous, so on and so forth. But I think to actually get concrete facts and details about Rakan KKM, it's actually quite scarce, this information. In fact, the Ministry of Health's own website for Rakan KKM has says a lot of very high-level things about it, and these are things in which I think most of us are familiar with, what it's supposed to be and what it's supposed to do. But I think the devil is always in the details, and sadly, that's the part that's missing, and it's generating a lot of anxiety among many Malaysians.
Okay, but overall, Mark, just in terms of what we do know, do you see any ethical issues with the fact that there will be an option for patients to essentially cut the queue or to pay for the privilege of immediate or almost immediate service?
There are absolutely a lot of ethical issues in play, and I think what we are most concerned about for those of us who are interested in this is really the inequalities that Rakan KKM threatens to create, simply by allowing the option for people with more means to be able to get healthcare services quicker, presumably get more specialist care at a time that's more convenient to them, really does start to create a difference between the haves and the have-nots. Now, people who are supportive of Rakan KKM have tried to assure us that the scope of Rakan KKM is really just limited to shorter waiting times, and it's limited to elective procedures. But even if that were true, that itself is not completely harmless. I think when we think about shorter waiting times, it's perhaps tempting to just think about, well, it's the difference between a half an hour wait versus a 2-hour wait. But if you consider, especially for those of Malaysians who are from, let's say, poorer backgrounds, ironically, they are the ones who are most time poor themselves. And for them, additional waiting time, a longer queue may mean another day of lost income, may mean additional child caring costs, and it may very well lead them to decide it's really not worth me waiting longer, and so I'm going to then skip my appointment. And likewise, when we say that it's only really going to affect elective procedures or elective surgeries, what's missing really is, what do you consider elective? Is a outpatient consultation with a cardiologist elective? Well, if you're really waiting in queue to check whether or not you have some serious heart conditions, a simple outpatient appointment like that may not actually be elective. It may actually have an impact on your health. Another example that was thrown about was, it might be a procedure for trigger finger. But if you're a manual worker, and you work using your hands, a trigger finger isn't something that's inconsequential to your livelihood. So can you actually afford to wait longer for that?
So part of Rakan KKM is also not just from the patient's perspective, but also from professional healthcare workers. The argument is that this initiative, Rakan KKM, will allow them to earn more. So, this much needed incentive structure that the private sector allows for, but without leaving the public healthcare system. Do you think that that's an argument that holds water? Is there merits in the argument?
So I think that there is a fundamental assumption that the powers that be are making when they float that. Essentially, the assumption that's being made is that healthcare workers are leaving KKM mainly because of low remuneration. But I think we would argue that it's more complicated than that. We've heard from healthcare workers on the ground, colleagues of mine even, that it's a mixture of culture, bureaucracy, issues with autonomy, the lack of career progression and welfare. And to imagine that some additional remuneration on top of that will shift minds in a large scale, I'm wondering whether that assumption holds true. And I think that assumption was also tested with the full paying patient scheme that was introduced in the Ministry of Health in 2007, whereby the idea was then to allow specialists and consultants to be able to actually work on full paying patients to earn that extra bit of income in order to retain them in the service. Now, there have been a couple of studies done, and the evidence is incredibly unclear as to whether or not it's actually helped retain more specialists than before.
Oh, okay, that's interesting. So how do we think about this? Because at the end of the day, this is an initiative meant to ensure the sustainability of the public healthcare sector, because MOH says they can't keep going back to MOF and asking for more money every year, despite the chronic underinvestment Malaysia is already making in healthcare, below the accepted 5% GDP. What do you think then of this trade-off? Is this something that Malaysia should continue working on, given how many concerns there are, or should we be looking elsewhere? Rakan KKM may not be the silver bullet that we need for the sustainability of our public health.
Yeah, it's hard to imagine that Rakan KKM will actually be able to solve this huge problem that we have with regards to the underinvestment of our healthcare system. Now, think about some of the things that we've heard about Rakan KKM, that it will only perhaps operate after office hours, it will only work on weekends, it will only provide a narrow scope of elective services. And when you hear these things, you start to think that, well, this is going to be a service that's going to be relatively low volume. And if that is the case, presumably then revenues aren't going to be that high, nowhere near the amount of money we need to actually make up for the underinvestment in our healthcare system. So even if everything goes right for Rakan KKM, it's hard to see it as the silver bullet that will solve our national healthcare problems. Ironically, if it were then to try to achieve that aim, it would have to massively scale up its scope and operations, which would then really do away with the national health service system that we have right now. And then in that case, our worst nightmare will come true. We will truly have privatization of our healthcare system.
Okay. Medical inflation, might it help address the runaway medical inflation that we're seeing, Mark?
I don't think so. I think these are very large macro market forces that are in play. And again, it's very hard to imagine that sort of like a part-time side gig healthcare service that provided in whatever little free time that our healthcare staff have, if at all, will actually help to solve this problem. My sense is that we would be better served spending our attention and our efforts on larger scale reforms of how we finance our healthcare, how we attract and retain our health workforce, and how we improve our population's health through preventive measures, through health promotion in order to reduce the burden on our national health system.
Mark, thank you so much for being on the show with me today. I appreciate your time. Dr. Mark Cheong there from Monash University, Malaysia, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching. Good night.